One of the great things about treating athletes, be it competitive or weekend warriors, is that they're highly motivated to get better. Medial epicondylitis, or golfer's elbow, is inflammation of the tendons on the forearm where they insert on the elbow. Essentially, the muscles of the forearm, which flex the wrist, all originate right on the inside of the elbow. So if there are repetitive forces, such as in a golf swing, that can cause inflammation and as a result pain. As we come down through, the forces generated in the forearm here put a lot of strain right on the inside of the elbow. And so over the course of a round, particularly if you're jamming the club into the ground, which is putting a lot of strain through here, or if you're hitting through some thicker rough, that's going to put more strain at the point of impact. So over the course of a round, whether it's 70, 80, or sometimes over 100 times, you can imagine that's going to put quite the strain on the elbow. It can occur with any type of repetitive activity. So tennis, for instance, is ironically a cause of golfer's elbow. Also, repetitive work activities, whether it's carpentry or operating tools or machinery, can also cause symptoms. In terms of the actual symptoms, it's generally going to be pain with repetitive activity, also tenderness to the touch right at that area. Initial treatments are going to include ice and activity modification. Stretching is important. And then once the symptoms calm down, strengthening those muscles in order to prevent recurrence. Physical therapy can be very helpful. Occasionally we'll do a steroid injection or cortisone injection, as they're commonly known. And then rarely, less than 10% of the time, it could result in a surgical procedure to alleviate the symptoms. In general, it always makes sense to try to, if you're going to be doing a repetitive activity, to make sure you stretch both before and after. Oral anti-inflammatory medicines, whether it's ibuprofen or naproxen, can be very helpful. Particularly with golfers, it's important to have appropriate technique, not to overswing, as that can certainly lead to issues. Well, the fewer swings you take in a round, the less likely you are to get epicondylitis, I guess.